Alright, hey guys, it's Mikko here again. It's now exactly 2 weeks since my DHI hairline redesign, and I'm here in Brisbane, at DHI Brisbane with Paul, having a bit of a post-op follow-up. So yeah, just trying to, I guess, show a bit the process as well, that what every single patient goes through when they have a DHI session done. So yeah, I'm all yours, Paul.
Yeah, thanks, Mikko. Look, the purpose of a 2-week post follow-up is really to ascertain exactly how the whole procedure went and how the recovery rate's going, and just make sure that if things are progressing the way we want them to progress. We expect the first week to show redness, second week really to show hopefully a little bit of activity at the hair root, virtually no real telltale signs of the procedure itself, and you should be back to normal life by this point.
Yeah, well, I am. Probably, I've been obviously recording the whole journey, in the Facebook page now, so people would know that it's been going pretty well. But yeah, I guess, the session, you wanted to hear...
Yeah, about the session itself. How did you find it?
When I went on the treatment bed and got the local anesthetic put in behind my, the back of my head, that stung a little bit, so maybe a discomfort of a couple of minutes,
yeah.
But then once it's numb, I didn't feel a thing, and I was told that I was actually snoring during the morning when the extraction was done, so I didn't feel anything. Then having a lunch break and then a couple of hours of implanting the hairs back, and yeah, so it's really painless process. So when I got out of the clinic, I obviously had the bandage at the back of my head. I had 2 Panadols right at the end of this session, just if in case I get some headache or a bit of pain when the anesthetic wears out. But it didn't happen. I don't know whether the Panadol helped or anything, but I didn't have any pain. Of course, if you touch the areas and things, it's a bit sore. Yeah. But yeah, I had no problem sleeping or anything.
Yeah, good. I think, and that's the key. We find, and we recommend to all our patients post-session, take a bit of Panadol regardless if you think you need it or not, because you just sleep really well that night. And if you have a good night's sleep the first night, when you wake in the morning, you feel 1,000 times better than a rough night's sleep. So yeah, it really helps the whole healing process.
Yeah.
And most patients we find, if they do have like a little bit of Panadol the night before, really need anything the morning after. I don't know how that was for you, but...
No, I didn't need. So I was supposed to take the bandage off the morning of the first day, but I decided, because I had a business meeting around lunchtime then, so I decided to keep the bandage still on then, so that it doesn't look red or things. So obviously it looks a bit obvious if you have the bandage, but that's what I decided to do. So I took the bandage off in the afternoon of the next day, and yeah, but it was really clean and cool. I think there was a video on the diary about that as well, so people would be able to go back to the Facebook page and see how it looked. But yeah, that's it. So I guess people who I met at the meeting, then they knew that I've just had the hair transplant and things, but they were quite impressed about the fact that if you forget the bandage, the front looked pretty cool, and I can kind of cover everything with our existing hairs, and so yeah, it doesn't really restrict too much of your life.
I think most of our patients are, like you said, are very surprised at how clean post-procedure the bandages are. We use the bandage really to control any spot bleeding and just make sure if there is any issues there, it would control it. But 95% of all cases is virtually no real bleeding post-surgery. And because of the topical antibiotic we give you, that makes more of a mess than anything else. There's virtually no blood there at all. It's just more sticky from the antibiotic topical.
Yeah. By the way, the first night, so I mean the same day after the session, I was, really religiously spraying the saline solution on the head, and I was kind of feeling that okay, I'm getting probably no scabbing because I'm getting all the little tiny blood drips kind of off, but it wasn't really the case, because there's always, with every single follicle, you get a bit of that skin as well.
Part of the epidermis. So,
so that dried, and that's why there was a bit of scabbing for probably day 7 or something like that.
No, that's
you know,
exactly it.
And then it's it was kind of gone.
And your first shampoo, how was that?
That would have been the 3rd day.
Yeah.
So what I did, I just put a little bit of mild, like baby shampoo, and I even diluted it with water, something, and really gently, kind of just rinsed it really over the top, and yeah, that was really it. But that was really good. Felt really good because for 2 days I could not wash. So it was getting itchy. First 2 days, and then it was really good feeling to get it cleaned.
No, it makes a big difference when you get that first shampoo in.
And it was the 3rd day, and then just kind of more or less I was back to normal routine right after that. Just being a bit more careful, obviously, on the especially this area kind of.
Good.
But it's started to grow.
I know. Yeah, you can see it. Looks absolutely awesome. Now, what we find, like, once you can lift those initial scabs off, which we try and get our patients to do within that first week, is get a little bit more vigorous as each day gets into it, and just really try and lift the scabs off, and you literally will be just left with stubble. And at that point, it becomes a lot harder to detect if you ever had a procedure, which we can see now.
So it's obviously growing.
Yeah, so as we expect at this point too, there's hardly any post-redness. So what they call the post-inflammatory responses seems to be controlling quite nicely. We've got good length out of the stubble, which indicates we are getting growth now. We know that we cut the hair very short, and we can actually see quite a bit of growth. The good thing with this procedure, because we cause a lot less stress to the actual graft, a lot of those can start growing from the day we inject. Not all of them, but a lot of them will start to grow from the day we can inject. And that's the whole purpose of not using scalpels within the procedure itself, is to really minimise the stress that can occur to a graft, and improve survival rate and the ability for that graft to start attracting its blood flow rapidly and grow from the early stages. So far so good. Looks awesome.
Fingers crossed that not too much of the shedding happens, but basically really excited to see how things progress now.
And obviously the donor side now is healing beautifully. We've got obviously a couple of spots there, but that's fairly normal. But the actual overall coverage is starting to come back to the scalp. There's no real disparity between density, so we haven't over harvested, which is great. So it's never even when you keep your hair short now, there's going to be no real noticeable towel signs that we've actually been up there and extracted any hairs, which is a long-term goal now, because ideally you like to keep your hair short, so we've got to make sure visually it's never going to be an issue for you moving forward, and obviously got enough room there for work later on if ever required.
So for now, for about a week, I haven't been conscious anymore about like how I look like. So it was that about a week that I needed to kind of I was kind of thinking about, do they notice I've had something done, or it was a bit red or something. But really straightforward now.
I think and I think that's the greatest thing, by making sure we maintain with really fine needles, keeping to that manual technique, not using machinery to do it, which involves larger needles, larger punches. So it really involves faster healing, quick recovery.
Cool.
And you're a classic textbook case for it.
Perfect. So my progress is on track, hey?
That's awesome. Look at that ear one. Just drop right back down. That's amazing. It looks fantastic.
Perfect.
Good work.